Good evening to all. Welcome to a very interesting topic today, the webinar on maternal immunization, bridging protection across lifelines. And to address the topic, we have with us someone very eminent for the field of pediatrics, Professor Dr. Sunil Kumar Agarwala, sir. It's an honor for me to welcome sir and to introduce him to everyone. Sir has completed MBBS, then MD. He is professor at the Department of Pediatrics at Sardar Vallabhbhai Patel Postgraduate Institute of Pediatrics at Qatar. It's an honor for us to have you in our platform, sir. I would now request you to please start with the topic for today. Over to you, sir.
Thank you, Arpita, for your kind introduction. I must thank IGCP platform for making this a reality to showcase different topics at different time. And good evening to all doctors, those who have logged here. I am going to talk on a particular subject. Everybody knows everything about maternal immunization, but I will be taking through the journey. What are the new things we must know? Whenever we are getting a mother, I mean a pregnant mother, how we are going to protect the mother as well as the upcoming baby. So these two things in life is known as you give the immunization to the mother, not only the mother, but also the growing baby or growing fetus will be benefited. So that's the topic title, Bridging Protection Across Lifelines. So before the conception, counseling on immunization must be there for a girl who is going through a reproductive age, particularly 18 years onwards, till she is going to be married. So in that situation, reviewing the vaccination history, we must know that this particular girl or woman, what are the vaccines she has completed in her childhood or in her past. For an example, if she has taken 2 doses of MMR, that means she is protected against rubella. So similarly, we have to know whether the chickenpox immunization has been given or not. Then if she has taken after marriage 1 dose of MMR, then she must not be pregnant for coming 4 weeks. Commonly vaccines we ask about, one is Tdap, another is hepatitis B, and MMR and varicella. And screen for sexually transmitted diseases, it is an opportunity for HPV prevention as well. Because in India, every year we are losing near about 70,000 women dying of HPV, which is the second most cancer in a woman after breast cancer, which is completely preventable. So thank goes to the Government of India and Family Welfare, who is going to launch this vaccine as a monodose in the National Immunization Schedule, and we will be targeting 9 to 14-year girls. They will be getting a single dose of HPV vaccine free of cost. So very good news. In fact, this is, as of now, we are giving 12 antigens in our National Immunization Schedule free of cost, and this will be a great addition, and gradually a typhoid and mumps inclusion into the MR component are in the pipeline. So now in maternal immunization, just a nutshell, antibodies that traverse via placenta to the baby. Whatever infection the mother had in during her childhood, either by vaccination or by infection, thus antibodies IgG, they were traversing to the fetus. And you see that starts to increase at week 13. It starts by going into the baby by 13 week onwards, 5 to 10% of maternal levels at week 17 to 22, 50% of maternal level by 28 to 32, and particularly towards the term, it exceeds maternal level by 20 to 30%. So this is a good news that most of the antibody they traverse towards the 3rd trimester. So if we are going to get a preterm baby or a premature baby, then definitely they are more vulnerable for vaccine preventable diseases because adequate amount of transfer of transplacental transfer of antibody has not happened there. So these maternal antibodies which traverse, they allow the baby to survive in this planet, not to have this kind of diseases up till the age of at least 9 months or 1 year. Transplacental transfer of antibody against measles, they allow the baby not to have measles before 9 months. Chickenpox, not before 15 months. hepatitis A not before 12 months. And once the antibody level goes down, the passive prophylaxis goes away, and that is the right time to inoculate that particular antigen into the baby. So active transport of this antibody do start in the 32 weeks, and majority of immunoglobulin are IgG, and they transfer via last trimester. So what are the rules? No live vaccine is indicated in pregnancy. Why? Because we do not get case cohort for the study. Any pregnant woman never allow herself for a study, for any trial, or any new vaccine to be given in the pregnancy so that the fetal outcome may be bad. So that's the reason live vaccines are not indicated. MR, MMR, varicella vaccine are contraindicated in pregnancy. If at all they are given, they should not be, or mothers or the ladies should not be pregnant up to 4 weeks after vaccination. All inactivated vaccine may be safely given in pregnancy as per individual vaccine recommendation. For an example, hepatitis B vaccine each can be given because inactivated vaccine. TDA vaccine can be given, flu vaccine can be given, but HPV vaccine also can be given. But the licensing authority that these vaccines are not studied in pregnancy, so that's why they are not to be given. Rabies vaccine can be given during pregnancy, irrespective of the trimester of pregnancy, because it is life-saving, and we have to save the life of the mother in order to prevent rabies. In a animal bite exposure, as per the category, we have to go for rabies immunoglobulin and rabies antigen or vaccine. So coming to first part, discussion on the TDA vaccination during pregnancy to prevent neonatal pertussis. Now, neonatal pertussis is not an uncommon disease. Many newborn, they lack in the pertussis antibody traversed by the mother, and they are susceptible for the neonatal pertussis. And those cases they mimic like neonatal sepsis, and they may not present with paroxysmal whoop, or they may just present to us by apnea, lethargy, pneumonia, and neonatal sepsis. So it is very difficult to know whether a newborn is suffering from neonatal pertussis. However, the drug of choice is macrolide. So in this scenario, it is difficult to diagnose and difficult to manage. And for that reason, it is known as that you prevent that infection in the upcoming baby. That means by giving vaccination to the mother. So it has been seen what is the rationality for pertussis vaccination during pregnancy. That DTP vaccine, immunity gap, that primary immunization 6, 10, 14, and one dose is given at 1.5 years, then second dose is given at 4 to 6 years. Then first dose of DTP is not recommended until 6 to 8 weeks of age. That means this age, 0 to 6 weeks age, is more vulnerable for the young infant pertussis. Infants are not protected till first 2 months of life. So vaccination for neonatal protections will ideally occur between the 30 to 32 weeks or towards the last trimester, so that the antibody can traverse via the placenta to the baby, and the baby can be protected from pertussis. So if you are thinking, mothers are the most common source of pertussis infection to the newborn. So now father, sibling, grandparent and other, and mother. It has been seen the mother is the most important source of pertussis infection to the baby, and she is coming in contact with pertussis, and this pertussis, bacilli bordetella pertussis, is transmitted from the mother to the baby. So in order to immunize out of the all household, house remaining persons, it is always prudent that if the mother is immunized, then the big source of pertussis is protected. So definitely that will give protection to the mother. The mother will not harbor this pertussis organism and is not going to transmit this infection to the baby. So maternal immunization is the most effective strategy in protecting young infants from pertussis till the first dose of TPD is being given. So what are the main points? More than 90% infants under 2 months of age pertussis require hospitalization. 75% pertussis related death occur in infants under 2 months of age. Mothers are the most common source of pertussis infection in the newborn. And Tdap has shown high effectiveness in preventing pertussis disease in infants less than 3 months of age. So what does it mean? The Government of India guideline or UIP guideline says that any mother being pregnant on the first contact you go for a T containing vaccine, that is TD. It is same as in office practice in the government sector. The same has to be adopted in the private sector as well. But the government gives another dose of T containing vaccine 1 month later or 1 month before the date of delivery. So that means 2 doses of TD is recommended in government sector. But here, in order to give protection against pertussis, we are substituting TD by Tdap. So that means TD to start with and end with the Tdap is the game changer to protect pertussis in the newborn and in the mother as well. So coming to the next infection, influenza during pregnancy and its prevention. Now I'll tell you, because of pregnancy is a immuno-altered state, it has been seen many maternal admission into the ICU, into the medicine ward, into the gynec ward, into the pregnancy ward are due to influenza. Some of them may go for complicated pneumonia and may need ventilation. And similarly, the influenza vaccine is recommended from 6 months onwards to the infant. So the infant from 0 to 6 months is vulnerable for influenza. So that's the reason we cannot give influenza vaccine before that. So what the thing can be done? So influenza vaccine to the mother. So let's see. There are many bodies, global bodies, national expert health authorities recommend maternal immunization with flu. Now WHO says, then all bodies, then FOXI also says, then Federation of Gynec Society also tells, SCIP says, IAP also says that 1 dose of influenza vaccine is recommended during pregnancy since many years. So this American College of Obstetric Gynecology, Royal College of Obstetric and Gynecology, then the Federation of Obstetric Gynecological Society of India, Indian Academy of Pediatrics, all bodies, they recommend 1 dose of flu to be given during pregnancy. And the benefit, let's see. The risk of disease is high in both mothers as well as the baby up to 6 months. Influenza imposes a high burden of maternal and fetal complication in pregnancy. It has been seen those mothers, they suffer from flu again and again during the pregnancy. They are having very bad fetal outcome in the form of small for death, preterm labor, and low birth weight babies. Benefit to the mother, decreased need of hospitalization, decreased adverse pregnancy and perinatal outcomes. So benefits to the newborn, decreased preterm and low birth weight babies. So definitely it has a very good impact that 1 dose of flu vaccine is recommended. Nowadays, whatever latest vaccine is there, that has to be given. Now, when to be given? At any trimester, it is to be. It can be given first, second, third, and preferably if it is given in the third or last trimester, particularly we can say 27 to 36 week of gestation, just like Tdap, then more antibody IgG can traverse through placenta to the baby, and the baby can be protected well. But it can be given throughout pregnancy in any trimester. So coming to a new vaccine during pregnancy, that is RSV, respiratory syncytial virus. It has been seen out of all viruses after flu, influenza virus A and B, the RSV is one of the important cause of pneumonia in mothers. And we know that this mother's RSV, they are also going to protect the baby from the RSV up till 6 month age group or infancy. So one of the major cause of pneumonia in below 6 month age group in the infant is due to RSV or bronchiolitis. So how we are going to protect? What is maternal RSV vaccination necessary? Why? It has been estimated that globally by 2019, 6 years back, there was approximately 66 lakhs episode of RSV pneumonia and 14 lakhs RSV pneumonia hospitalization in infants less than 6 month age group. More than 95% of RSV pneumonia episodes, more than 97% of RSV attributable deaths, all age bands were in low and middle income country like India and Africa. Then we say that 61% of hospitalization for pneumonia in children less than 5 years is due to viruses and 31% of them are due to RSV. So RSV is the commonest cause of viral pneumonia in a less than 1 year child. So what can be done? The RSV vaccine by Pfizer, Abrysvo, is indicated for active immunization of pregnant women, that is same 32 to 36 weeks of gestation, for the prevention of RSV pneumonia in infants from birth to 6 months of age. That means this vaccine is a bivalent vaccine, meaning it targets both RSV and RSVB subgroups, and it is administered as a single dose. So the point to take is that if a lady has taken one dose of this RSV vaccine in the prior pregnancy, in subsequent pregnancy, there is no need of further RSV vaccine. So that is a beauty that many affluent countries, I mean Western world, they have already incorporated one dose of RSV vaccine in the pregnancy. So as of now, what are the vaccines they are recommended during pregnancy? And regarding RSV, RSV pneumonia hospitals are most common in infancy, preferably below 6 month age group. RSV vaccine Pfizer Abrisvio is indicated for active immunization of pregnant women 32 to 36 weeks of gestation for the prevention of RSV infants from birth till 6 month age group. And RSV vaccine is currently recommended as a single lifetime dose only. And this vaccine particularly is a bivalent vaccine, and this is given as a single dose vaccine. So it means that what are the vaccine we can give during pregnancy? Let's have a note of that. TD, TDAP, and TD and TD in government scenario, one dose of flu throughout pregnancy, and another inclusion we have seen that RSV should have been given if it is available to a pregnancy or to a pregnant lady. So now, as of now, this RSV vaccine is not available in India. Shortly, once it is available, we can take the help of this RSV vaccine, which can be given through pregnancy. So take home points. So dear doctors, preconceptional counseling regarding the MMR, varicella, HPV is important. If the HPV vaccine, it is an window of opportunity so that the lady will not develop HPV related cancer. And MMR and varicella to prevent this rubella, congenital rubella syndrome and varicella zoster baby. So that's why each lady before pregnancy should have inoculated with MMR and varicella, which can prevent at least congenital rubella syndrome and varicella fetopathy. During pregnancy, start with TD, end with TDAP, particularly 27 to 36 weeks of gestation. One dose of TDAP is recommended in each pregnancy, irrespective of the gap. Single flu shot is during pregnancy can be given in any trimester. If the mother found to be HPS positive, then HPS antigen to be given, preferably within 12 hours, along with hepatitis B vaccine in adult thigh. That means preferably that this hepatitis B surface antibody to be given, preferably within 12 hours, along with hepatitis B vaccine in adult thigh. Live vaccines are contraindicated during pregnancy as a rule, and Pfizer's Abrisvio is recommended between 32 to 36 weeks of gestation to protect newborn. So in order to summarize that we are going to prevent minimum tetanus, diphtheria and pertussis in mother as well as to the baby, and by giving flu we are giving protection to the mother and the baby, and finally the RSV, which is upcoming and the Western world has already adopted, and very soon once it is available we also can give this vaccine. So particularly if you are giving all those vaccines, the robust antibody level which is being formed during the last trimester will be traversed via placenta, and it is going to accumulate in a very good way in the baby's blood, and baby will be protected for a couple of days, where the maximum RSV infection, maximum flu infection can set in, and we can prevent a lot of neonatal and particularly infant mortality by vaccinating this kind of vaccine to a mother. So I urge to all the doctors, please be an ambassador of all the vaccines, and remember that what the practice in government sector is going, the 2 doses of TD, that is a as old, maybe 40-50 years we are enjoying 2 doses of TD. Now the time has changed. Once the mother is affordable and you know the science, start with the TD, end with the TDAP, at least 1 month gap, or preferably TDAP 1 dose to be given in the second trimester. At least as of now, never forget 1 dose of flu vaccine during pregnancy, which can minimize the burden of flu in the mother and its fatal outcome, and the flu infection in the baby up to 6 months of life. So thank you very much. This is slogan that CDC Atlanta says, as of now in 2025, not a single child should die of vaccine preventable disease. So it is we are the ambassadors to prevent this type of vaccine preventable disease related death by giving vaccination from 0 age till any age. No age is a bar against vaccination, and the COVID pandemic has taught us that we have started this vaccination beyond 60 years, then come down to the age of 50 to 60, then thereafter 18 to 60, and we have come down to 12 to 18. And COVID vaccine has given importance, and it has opened the interest of the public and the community people how the vaccine is going to protect from a lot of death related to the vaccine preventable diseases. With that note, I am stopping here. I thank each and everyone, those who have logged over here. If there are any questions, I request Arpita, please ask me, then I will try to answer to that. Over to Arpita, please.
Sorry, sir. Thank you, sir. Thank you so much for the insightful presentation. Sir, with your permission, can I take questions from audience now?
Yes, 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 please.
So I would request everyone who is present with us, kindly put your
Hmm.
questions in the comment box so that I can read them out to sir.
Huh.
Meanwhile, we have received a few questions.
Hmm.
Sir, the first question is, how does maternal immunization provide protection to not only the mother but also the newborn in the first few months of life?
Always we say there are two ways. One is passive transfer of antibodies from the mother to the baby. Already I told passive transfer of antibodies, I mean polio antibodies. Number two is your measles antibody, then hepatitis A antibody, then chickenpox antibody. They protect the baby in the first year of life. Second is we are giving to the mother the TD, Tdap, flu, and nowadays we are telling that it has been started the RSV vaccine in the Western world. All those antigen they produce antibody, and these antibodies via placenta they go to the baby and protect the baby. So in one inoculation, in one injection, we are protecting mother as well as the baby. How the baby is protected? Because baby after birth is vulnerable for all those infections. But because of this antibody which is traversed from the mother to the baby is going to protect the baby after birth. For an example, I'll tell you in a simple language, the DPT, that pertussis vaccine first time we are giving in India at 6 weeks or 1.5 months. Once the baby is 1.5 months old, we are going to give the vaccine. So how we are protecting from birth till 1.5 months? So that's the reason if the vaccine is Tdap, that is Tdap, T, D, and AP Asella pertussis, if that is given to the mother, the antibody will come to the baby and the baby will be protected in the first 1.5 month to 2 months of life. So that is the beauty that we are protecting mother from tetanus, mother from diphtheria, mother from pertussis, as well as the baby. So it is one injection, two benefit. So the benefit is given to the mother as well as to the baby. So that's the answer. Yes, Arpita,
Thank you,
please.
sir. Thank you so much. Yeah. Thank you so much, sir, for answering the query. Sir, what is the future advancement in maternal immunization are likely and have the greatest impact in the coming decade?
Coming.
In the coming time, sorry, coming
It's a
years.
coming time, coming time. I'll tell you, it is always many a times the scientific people they think why to give vaccine to the baby and why not to the mother so that the baby will be born with some balance rupees in the bank. For an example, the baby is born with some antibody inside his body which is going to protect from the infection. For an example, we are giving flu. Now, flu infection, if it is given to the mother, the antibody is going to prevent from the flu till 6 months of life. So that is a good thing. Now you are entering into a planet. I mean, the baby is coming out of from the mother, who is under the umbrella of the mother, now coming out. Now, baby has to stay, survive in this planet independently. So who is going to protect? Because we are giving all the vaccine which are being recommended from the age of birth and 6 weeks, 14 weeks, and 10 weeks, 14 weeks, like that. So if the mother is inoculated that vaccine, definitely that is going to protect the baby in the initial part of life. Because for an example, flu vaccine is not given below 6 months. So how the baby will be prevented till 6 months? So it is to give to the mother and the antibody of the passive prophylaxis which is being generated in the mother goes to the baby and the baby is protected from that. For an example, I'll tell you, a lot of babies are being admitted in my hospital with bronchiolitis, that is RSV infection. Many children they die because of that. Now, if I want to prevent that death, then I have to give RSV vaccine to the mother so that the antibody will come and the baby will not suffer from common cold due to RSV, and I can prevent a lot of death. So it is a futuristic strategy. As of now, the government of India gives 2 doses of TD. If any lady in India being pregnant, they will give 2 doses of TD, that is known as tetanus containing vaccine. Previously, it was TT. You must be knowing as a layman that TT, tetanus toxoid, now it has been converted to TD. Now, D means diphtheria. Now, government and WHO says that diphtheria must be eliminated from the world. So TT has been replaced by TD. Now that TD is given in government. Now we the what I say in private practice, as by WHO, as by CDC, as per our IAP, as per our FOXY guideline, we are recommending 1 dose TD, another dose of TDA, and at least 1 dose of flu vaccine to each and every pregnant mother, so that we can prevent 4 diseases. What are they? Tetanus, diphtheria, pertussis, and flu. As of now, the RSV vaccine is not available in India. But if a lady being pregnant in US is going to get this vaccine, if the lady is in Europe, that can she can get, but that vaccine is not available in India. So just theoretical knowledge, I have updated the knowledge of my doctors. So let us know that this vaccine is there in the different world, but our world it will come. Then only we can give. But more science will be known once the vaccine will be available in our Indian market. But my saying is that in an upcoming way, more and more antigen may be included into the pregnancy, so that we can prevent a lot of diseases in the upcoming baby. Because baby is naive, the baby immune system is very weak. For an example, immaturity of the immune system in the neonatal and the early infancy allow the baby to succumb from a lot of disease, and the disease can be fatal, the baby can die. And we know today only we got the data, infant mortality rate of India, IMR, by 2023 census, each 30. Previously it was 32, now it is 30. Now if I say 30, 21 newborns they die. If I can give some vaccine and the neonatal mortality can be minimized, then definitely it will be a boost to the community. We can prevent a lot of death due to vaccine preventable diseases. So that's the upcoming time will say what are the vaccine can be given. And as of now, we must remember TD followed by TDAP, not the reverse, and 1 dose of flu. This much we can give this message in the mindset of all doctors and paramedicals, that these 3 vaccines to be given during pregnancy of a lady who is going to be pregnant in our country.
Right, sir. Thank you, sir. Thank you so much for answering our queries, and thank you so much for the wonderful session, sir. I am very sure the attendees who have attended today's session have been benefited through you. Thank you so much, sir. Thank you. With this, we are concluding the session here.
So thank you, Arpita, for nice moderation as well as always. And you youngsters, particularly, I have seen 2 platforms. One is IJCP and another Planet platform. I see almost all our youngsters doing wonderful job and moderating session very nicely. So thanks from my core of heart. And I must thank all the doctors, those who have logged in. And probably these are all recorded sessions, so that you can upload, and many more doctors can see and can educate them from the existing knowledge. So with that note, I must say, living here to meet you again in the next month or any other opportunity. So thanks a lot.
Sure, sir. Thank you, sir. Thank you so much once again. Thank you.
Yes.